record classes so that you have a copy of the recording to look back at if you want to. Okay, thank you, Tracy. Welcome, welcome, welcome. So are you excited? I know some of you might be, some maybe not. So this is actually your first, are you taking Med-Surg 1 as well? Most of you are? Okay. Okay, so this and Med-Surg 1, the first two nursing classes online. Okay, we do things a little bit differently than they do on campus. Okay, so it's really important for you to know the policies of the online courses. We have to be very consistent across the board. So all the OB instructors teach from the same textbook. We have different styles, but we have the same information that we're passing on to you. Okay, so there's a lot that we want to cover for your very first class. Okay, we'll do about an hour of orientation. Okay, and no matter what we're doing on Zoom together, feel free to interrupt. Okay, just say, can I ask a question? Okay, don't wait for me to stop talking. Okay, you can use your virtual hand. If you go down to the reactions at your Zoom taskbar, you can put your hand up, yeah, like Thomas did.
Okay, so I have a question. As far as the book, I seen there's a 6th edition and a 7th edition, and I have the 6th edition. Does it matter?
You have free to you the access to the 7th edition.
Really? Okay.
Yeah, it's in the, if you go to Canvas, if you go to your Canvas site I think it's called the student resources. There's a link there so that you can access the text.
Oh, okay. Good.
Yeah, yeah. You'll have to know that. Yeah. Now there's probably subtle differences between the texts. So it's not anything, it's not that don't buy anything for sure. Okay. If you're one of those that really wants the text in hand, and you already have access to a hard copy of the 6th edition, yeah, you can use it to look at pictures and stuff like that. But just make sure you're using your 7th edition for updates and stuff. Okay. All right. Any questions so far? Hey, Francis. You're in your car. Where are you sitting? Are you sitting at home?
No, I left a doctor's appointment, so I'm sitting in the parking lot.
Oh, okay. All right. Yeah. So don't do any driving. Okay. So how far are you away from home?
About 45 minutes.
Oh dear. Oh dear. Okay. All right. So Janice, are you here? Janice Roberts. Cassandra's not here either. Okay. Francis is here. Rachel's here.
Yeah. Hold on just a second. I don't know if it'll take me off the camera, but I got to look at Canvas real fast.
It shouldn't.
Okay.
Take you off camera.
Okay. So you got that.
We still have quite a few students missing. 1, 2, 3 students missing. 4. That's not terribly uncommon, but it is a small class. Well, let me start out our time. My name is Dr. Zeller. I'm your instructor, like I said. I did post my short biography on Canvas. Have most of you accessed your Canvas? Anybody having any trouble with access to their Canvas? Okay, are you familiar with it enough? Using it in your other classes? Yes, okay, okay, good, good. That's really important that you're familiar because that's where you're going to get your information. Okay. All right. Another thing I want to remind you, make sure that your Evolve account has your Fortis as your primary email. Okay. If not, your Canvas is not going to link to your assignments. Okay. So you can go into Evolve and change that. Okay. So at the beginning of class and everything today, we want to make sure all those things are working correctly. Okay. I have been a nurse since 1985. That's a long time ago. And so nursing has been my whole life. And I've done a lot of everything, I think. I started out graduating with my bachelor's at Ohio State, so I'm originally a Buckeye. However, I live in Michigan now. I spent some time in Florida practicing in surgery at Tampa General, the very large hospital, and then moved to Tennessee, where I recently moved away from. Okay. So I was in Tennessee for like 25, 26 years. And then I moved to Michigan almost 2 years ago. So I love Michigan weather. And that's the main reason I'm up here. Me and my husband. Okay. So labor and delivery. Yes, I've done labor and delivery. I've done a lot more prenatal, postpartum. I did that as a nurse practitioner. So my favorite part of OB nursing is the prenatal and during antepartum and then postpartum, because this is an opportunity for me for what I love to do, and that's teach. I love to teach my clients. I love to help them understand what's going on with their body and what they can do to have the best outcomes for their pregnancy, for the client and for her baby and her family. So that's why I like prenatal, antepartum, and especially the high risk patients. So in my practice in Tennessee as a nurse practitioner, I took care of a lot of high risk clients who had diabetes or lupus or had some kind of blood disorder or, oh, hang on, it's one of our students. Hello, Cassandra? Are you trying to get signed on? Okay, yeah, no, my Zoom number is, if you have a pencil, 656 370 6357. Okay. 6357. Just jump on Zoom and put that number in. Okay, bye-bye. Okay. So I took care of a lot of high risk, my favorite thing to do. So for the first 3-4 weeks of this class, we were talking about normal things, okay? Normal pregnancy, normal antepartum, normal intrapartum, and postpartum. We began to pick up some abnormal things or some things that can go wrong in week 4. And then we actually began to discuss in week 5 high risk scenarios and what could happen. Okay. So overview of pregnancy, I sent you it's not a PowerPoint, it was a PDF document that gave you like an overview of pregnancy, what a trimester was, what pregnancy, why do we go by weeks in pregnancy and not months? So look at that PowerPoint and kind of skim it and give you an idea if you don't know anything about OB. And that's one good way to get started, okay? Don't hesitate to call me if you need to talk to me or text. You can text me for any question. Okay, I tell students that error recorder, and I don't get but maybe 5 or 6 students who use that opportunity. So please do that because you might just have one simple question and you don't want to take the time to make an email, write an email. wait for me to respond, although I usually respond usually within a couple hours. But you can send me a text as well. Just let me know who you are, okay? Because I won't know unless you tell me, because you're not in my phone, okay? So that's one thing that's really important to me as an instructor, that you know that I'm available to you to help you through this class. I had somebody actually ask in their introductory discussion at what difficulty level this class is. And that was really hard for me to say. You know, one of your other classes might be more difficult, but I do know it's not an easy class. It's not, because we talk about some things that you haven't learned yet in basic things like what is shock. You haven't learned that at med-surg yet. You know, we talk about diabetes. You haven't studied diabetes. So not only are you learning about pregnancy, but you're having to learn about diabetes too, okay? So that's why I say, please just reach out to me. So let's get, anybody have any questions right now before we get started in the orientation? Okay. If I'm talking about something and you don't want to interrupt, although I want you to, but if you don't want to, please write your questions down. Okay. Come to class every week with pen and paper. Okay. So you can write questions. Okay. Let me see what I'm going to do here. So let's talk a little bit about, now this could be pretty dry, but it's really important that you try to absorb as much as you can. And I recommend that you download this, print it out, at least the pages that have important information on them that you can refer to, because there's a lot of information here that you might not see anywhere else. It's considered our policy. So it seems like a simple question, but it really isn't. What's online learning? Well, we use computer technology to meet together. Okay. We learn during class time. We reinforce what you already have prepared for before coming to class. And we have conversations. We're going to do activities together, case studies. We might play some games and just hands-on stuff in class. Or you might just sit and listen to me. You might work in a breakout room with a group of people on an activity. So we do all kinds of things to help you begin to understand the things that you need to know, okay? We have all kinds of resources for you other than Canvas resources. We have PowerPoints that we share with you. We have other documents. We have videos that we'll give you links to. We also have recorded videos from last quarter that we will be sharing with you, especially when it gets close to an exam. We offer extra Zoom sessions to prepare for your exam. And they're usually scheduled the week before exam. You come onto Zoom and we prepare for the exam together. Okay. We're studying together, in other words. Okay. And so let's talk about how you accomplish homework assignments. Okay. Assignments are, I said this in one of the announcements, or not one of the announcements, but one of the students who asked a question about what can I do to help her learn? And I told her that your homework assignments, treat them as treasure. You're assigned things to do, and the purpose of that is for your learning. Don't think about homework as just a drudgery thing to get it done, get it out of the way, because that's not what it is. It's part of your learning. Okay, so take them very seriously. Some of you know each other in this class, but some of you don't, because we've got a lot of you from Cookeville, a couple from Centerville, and then we've got some Orange Park people here, one so far. Tracy, where are you from? Where's
I
Tracy?
attend in Orange Park, but I live in Ocala.
Okay. And Francis, how about you?
I attend the Pensacola campus.
Okay, okay, thank you. All right. So make sure you fill out your introductory discussions so I get to know you a little bit better. Okay. So who do I get a hold of if I have a concern or a problem or a complaint? Well, I'm the first one you talk to. Okay. And that's true for every instructor in OB. If a student's attending another class, it's their initial or their primary instructor that you should contact first. Don't go to the dean first. Come to me first and ask me the question, okay? And I will give you information. I will direct you in the right or direction to get you what you need or answer your question. Okay. If I can't help you because it's something about simulation or clinical, then you're going to have to reach out to your campus. Okay. I don't working on getting better communication between online and on-campus instructors, but that, we're also busy. It doesn't always happen that way. So if it's about simulation or clinicals, a schedule or something, I can't really help you with that. So you'll have to ask your dean on campus. Darlene, Dr. Darlene Brown is the national online dean. In other words, you go to her when no one else can answer your question. If it's about changing your schedule this week, okay, you would let me know and copy Darlene on it, okay? And Dr. Brown, I shouldn't say Darlene, Dr. Brown. Dr. Brown has a student phone number on this screen, 720-665-6101, that you can call her or you can text her, identify yourself, let her know what campus and what course you're in. Okay, and she will be able to help you. But a lot of times I can contact her as well for you. Okay. So I'm available by cell phone. Okay. I'm available by email. Okay. And I can give you feedback. I can instruct you what you need to do, or we can discuss what strategies might help you. If you don't know how to do something, then you need to let me know. Okay. I do have my phone number in here. It's very tiny right there. 517-745-3815. It's also listed on Canvas in several places. Etiquette or netiquette, okay? Just being professional. You're going to be a professional registered nurse when you graduate, take your NCLEX and pass it and get your license. And you will be a professional, so you're expected to behave that way. So now's the time to do that as a student. I expect you to be professional, okay? If you do not respond to me during Zoom, if you're on Zoom and you're doing something else, you're not in class, okay? So if you're not on camera and you don't respond to me, that means you're not in class. And so after I call on you a couple times and you don't answer, I will remove you from Zoom and you won't be given any credit for attendance and you won't be able to get back on. Okay, so please remain attentive during class, ask questions. Okay. Be considerate of each other. You need to support each other. If you support somebody else, they will support you. In other words, helping someone understand something during class even. I've had students explain something about technology that I didn't know. And we need to return favors like that, okay? Use proper language. Use nursing language. Don't use any slang words. For example, we talk about substance use disorder in this class, and one student was writing a discussion question answer and she used the word stop using. Well, that's not a nursing vocabulary. That is vernacular. That is That is street vocabulary. It's common lay people vocabulary. So we want to use proper words, okay? Be careful how you send emails. Think twice before. Emails give us a lot of information, but remember, it doesn't show. You can't hear the inflection of words. You can't feel the emotion necessarily in email. So be very careful. So our classes begin Monday at midnight, early morning, Sunday at midnight. Okay, so all your assignments will be available Sunday at midnight, 11:59 p.m. or 7 in the morning. Okay, we go by mostly Eastern time zone because that's where I live. Orange Park would be Eastern, Centerville Eastern, but everybody else looks like Pensacola and Cookville are Central time zones. So keep that in mind, and I will remind you, okay, as we go through the days, okay? So I've already set up the Canvas shell according to when your assignments are due, okay? So your assignments will be due on Sunday night. So this week, you have some calculation problems to complete. Okay, you have all this week until Sunday at midnight to submit those into Canvas. If you need help, don't wait till Saturday to send me a text. Okay, send me a text before then or an email saying you don't know how to do this one. And I can talk to you on the phone, or we can jump on Zoom together and I can help you work through that problem. If you're working through it, you think you know how to do it, you want to make sure you're doing it correctly, just send it to me in an email and I'll look at it before you actually submit it. Because once you submit it, I have to grade it accordingly, okay? So get that done before Sunday night. Don't start out with a late assignment, okay? Get your assignments on time. If you still can turn it in next week after Sunday, all of next week until Sunday night, but it will be deducted by 10%, and that can really hurt in the 8 days and beyond, you need to go ahead and do that assignment, but you're not going to get any credit for it. Any questions about late assignments? Okay. If you have something going on, and I don't want details, I don't need details, but if you have something personal going on in your life, and you're finding it very difficult to complete your assignments, you need to be letting me know these things, okay? Let me know if there's something going on. And you might need a couple extra days to get your assignments done. I can be pretty lenient, but you need to communicate with me. Don't tell me Sunday night that you need more time. Let me know early. I'm going to try to get them done Sunday night, but I don't know if I can. And we could have a discussion about that. It's really important that I know what some of your struggles are so I can help you prioritize what you need to complete or not, okay? Attendance for Zoom class is taken every week. The Zoom platform itself keeps a record of who's signed on and who's signed off, when they signed on, when they signed off, how long they were on. So I know exactly what's going on. And that's an official record that we use. So do not be late to class. If you're late 5 minutes, if you sign on at 2 minutes after 3 p.m. or 2 minutes after 2 p.m. Central Time, you'll be late and your attendance will be deducted by 15 points. Or I'm sorry, 15 minutes. Okay, you'll be deducted. So we keep a tally of how much class time you've missed for the whole quarter. If you miss up to 20% for the whole quarter, 20% of class time, it might have been 15 minutes here, it might have been an hour here. If it adds up to 20%, then at the end of the quarter, your grade is going to be dropped, the whole letter grade. So if you got an A in the class, you're going to end up with a B. If you get a B in the class, you're going to end up with a C, which could mean if it's not a C plus, you failed the class. So just be here. Okay. Being here means that you're here looking at me or looking at your classmates. You're in front of the camera. It means that I don't look at your ceiling fan or something else. It means that you're not driving or you're not talking on the phone. One time I had a student actually laying in bed talking on the phone and she wouldn't respond to me. So she really wasn't paying attention. Okay, so this is really important. We're talking about learning to become a nurse, and you can't be talking on your phone and passing out meds at the same time. Okay. All right. If you don't attend class for 2 weeks in a row, you will automatically be dropped. And you can't make up that time. Okay. Steps to success. Dr. Brown also posted an announcement on Canvas of what helps students succeed in this class. If you haven't read her announcement, please do that. She goes into a lot more detail than what I'm doing today. So it's real important that as a nurse, you're organized. You know exactly what you need to do. You know what your priorities are. And chances are when you start working, you'll have some kind of organization plan for taking care of your clients. Okay. And for nursing education, using a calendar to organize yourself is going to be very important. So spend some time setting up a calendar. In that calendar, you're going to put all of your assignment due dates for all of your classes. Okay, write in when you have clinical, write in your lab time, in your class time, simulation time. What's your work schedule? Put that in. Put everything on one calendar so you can look at it and say, okay, now when do I need to prepare for my assignments? Okay. If you want me to help you with that, I will. Okay. We'll go over the assignments individually shortly here, so I'm not going to read all this stuff. Okay. Keep in contact with me. Really important that these first three things are super important. Okay, keeping in contact with me. Reliable, stable internet connection with your computer. If it means that you have to go to campus to attend class, because the campus internet connections are pretty stable. So just take your computer and go to campus and find a place. Okay. Maintain a schedule. That's what I said. Quiet place, free from any distractions during class. Read your assignments, instructions very carefully. Canvas is really important that you access. Here it says 4 to 5 times a week. That's about once a day. You might double check. I might have added an announcement. So just looking at the announcement quickly a second time, making sure you didn't miss anything. Okay. So make sure you get your assignments turned in. Think about what you're going to be doing the following week. I want you to, I don't open up all the modules for you to look at now, because I want you to focus on the task at hand. So for this week is your introductory discussion and your math, okay? And then, of course, reading your book. And we're going to go over that in a minute. So if you don't know how to log into Canvas, you need to meet with me after class, and I can help with that, you with that. So for OB, you need to come to class prepared. And what that means is that you need to have looked over the reading assignment, the concepts before coming to class. Okay, so if we're talking about next week, we're talking about anatomy and physiology of pregnancy. We're talking about the changes in the woman's body, cardiac changes, respiratory changes, all those things. And your book goes into those very detailed. So have an idea. I'm not saying you have to totally understand it. I'm just saying look and see what we're talking about so that you can have conversation. And when it comes to quizzes, you have a quiz next week. And that quiz is going to cover content from today, as well as 2 of the questions are going to cover next week's content. So that means you need to prepare for next week. Okay. Office hours. My office hours are an hour before class every week. If you come early to Zoom on Mondays, I'll be here. Okay, in case you want to meet with me for some tutoring, or maybe 2 or 3 of you want to come a little early and discuss a problem. Okay. We can do that too. All right. So we have lots of learning activities. Okay. So Zoom classes. We have one instructor that likes to do like open house. She'll have Zoom sessions, just open door, jump on her Zoom and ask some questions. And she usually does that before exams. That's Dr. Roberts. That's one of the things that she likes to do. We have, like I said earlier, Zoom sessions prior to exams. They're called review sessions or study sessions. You have 3 exams plus the HESI. And so week 3, week 6, and week 8, we will have review sessions for the exams. And we find that those students who attend those sessions and meet with me usually do very well in this class. So what content do we have in this class? What does our grades look like? What are key graded assignments? Well, the key graded assignments, KGA, are the quizzes, the exams, and then the HESI test, the final exam, which is in week 11. Those are the 3 areas. They're called KGA. So if we averaged your scores on these 3 things, that would give us an average, a key graded average. Okay. So you can see that the exams have a lot more weight. It's really important to do well on the exams. The quizzes, not as much. You have 5 quizzes that you take that are key graded, and then you have the HESI, that's 20%. Okay. This last quarter, I had students that might not have done super well during the quarter, but they did really well on that HESI test. And that told me that they learned a lot. And so that thrilled me. If I had a student that was averaging 80% on exams and they get an 86% on the HESI, that means they learned what they needed to learn. So you have to have 78% average with all of these together. The KGA has to be a 70% in order to pass the class. Okay. The rest of it is considered homework. Case studies, NCLEX questions, all these things below are considered homework assignments. And we also average up homework assignments, and you have to have 78% on your homework. Okay. If you don't have 78%, you better have a really high KGA. Okay. We've had students that had an 86 on their KGA, and yet they didn't do much homework at all. And that dropped down their grade, so they didn't pass the class. So always strive to do as high of a score as you can on your homework assignments. They're not timed, so there's no reason not to do well on them. Case studies have a pretty heavy weight. You can see they're 5%. So don't take them lightly. They're great resources for learning. You have 4 of them to do. Okay, so this is how your components are broken down. So for the first 5 weeks, what you'll see in Canvas as far as your grade is an average of your exams and your quizzes. Homeworks are not going to be calculated into that yet until week 6. So then I'll turn on the homework scores and you'll see, oh, if you have an 86 with your exam and your quizzes, and then I turn on the homework scores and it drops down to 80, that means you've not been doing your homework. And that's not a good sign. Okay. Then I'll turn them back off at week 8. This will give you an idea how you're doing on your homework and how you're doing on your KGA. Okay, and this is just a repeat of what I said. So the quizzes, you'll do the KGA quizzes. Your first one is next week, and we'll do it at the beginning of the class. So we'll all be on Zoom and you'll be taking your quiz. Okay. And then the exams, however, are going to be taken during class 2, but you'll be on ExamSoft to take those. So the quizzes and the exams are timed. You have 1.5 minutes for every question asked. Okay. And you only have 1 attempt. You can only do it 1 time. You can't redo an exam. You can't redo a quiz. If you miss, let's say you don't come to class next week, you miss the quiz, you get a 0. Okay, you can't make it up. So this is just walking you through the exams. So your first exam is in week 4. We will all be getting on ExamSoft to take your exam. Anybody not familiar with ExamSoft? Okay. If you have accommodations, let me know, okay? And I will make sure that your quizzes and your exams are set accordingly, okay? If you would rather, or if it's more convenient, or if your internet isn't very stable, then you might choose to take your exam on campus. You can find an instructor or a staff member in the nursing department to proctor you, so you don't have to be on Zoom, or you can just join me on Zoom while you're sitting in campus. We'll go over more specifics about taking exams the week before you take your first exam, okay? So it's in here so that you can refer to it. During the exam, very important, we need to see your photo ID to make sure it's you that's taking the test, okay? We're going to need to see everything around you during the exam. Students have been very clever about coming up with ways to make little Post-it notes and put it on the computer, and nobody sees it but the student. If you're having to do Post-it notes, it means you're not ready for the exam. So let me know if you feel like you're not ready for the exam, because I don't want you to feel that way. I want you to meet with me well before the exam so you can get some guidance, okay? If you miss class during exam week, so week 4 on Monday, if you're not here, you will get a 0 for your exam unless something has come up and you need to notify me at least 24 hours ahead of time. Okay. If it's an emergency, you have to have a documentation. You have to show us something that says that you were in the emergency room or you had your child in the emergency room. So if you have some commitments already this quarter that were arranged prior, then you need to let me know now. Okay, send me an email. If you have somebody in your family going to get married or something and you're going to miss class and miss a quiz, and then we need to determine how we're going to resolve that. Okay. So like I said, it's really important to stay in contact with me. So planning your time, it's important that your schedule, that you look at the syllabus and look at Canvas at the same time. Week 1, what do you have to do? Put it in your schedule. What are your assignments? What video do you need to watch? Make sure that you set aside block time to prepare without any distraction. It's better that you sit down for an hour uninterrupted and focus on something than you sit with a child on your lap trying to read something and spending 3 hours doing it. Okay, it's better that you just spend 1 hour without distractions. So here's just a calendar, an example. Take in the syllabus and plug it in what is due. So this is again a reminder of your late assignments. Anything turned in 8 days or later doesn't get credit. NCLEX questions, I will reuse the Saunders text to do these kinds of questions. And the link to the book is on Canvas. So you'll have to do is click the link and I can show you that. Week 3, that's your first set of NCLEX questions that you have to do. So click on the link, it takes you to the book and it gives you instructions here how to submit your test. And when we get to week 3, remind me and I'll show exactly how to do this. For your submission of NCLEX questions, no screenshots. It has to be the PDF form. You're required to do 50 questions at a time. Okay, don't send me 10 sets of 5 questions or 5 sets of 10 questions. It has to be 50 total. And if you get 47 of the questions right, then you get a 47 score or 94%. Okay, you don't get 50 just because you did them. Some campuses giving credit for NCLEX questions, giving you full credit 100% on your NCLEX questions, even when you didn't get them all right. Okay. So if you score a 94, that's what you get. You don't get 100. So there's another link in your modules on Canvas for another assignment called a HESI case study. Same thing, when you click on that link, it takes you to the case study. And the case studies have a heavy weight, and they're usually 21, 22. I think the last one is a 30-question test. And it's like a, almost like next gen type question. So they're not timed. So look up the answers. Okay, if you're working on a case and you don't know what the answers are, then look it up in your text. And that's what those are. Discussion posts. You have an assignment, discussion posts, and there's a rubric that gives you instructions how to do that, answer it. So next week, you have a discussion question to answer. It's about unintended pregnancies worldwide, 50% rate. So what can we do as nurses to just to improve the morbidity, improve the outcomes of pregnancies? Half of them are not planned. So the indication is that we need to be educating reproductive age clients on pregnancy, making sure they're healthy. And so I'm going to send you an article that everybody's going to read the same article for this very first discussion post. It's really good, and it really hones in on what we're talking about next week. And we're going to touch base with it today if we have time. Okay, so those are discussion questions. Discussion questions have to be referenced. In other words, you're going to find an article and read it, and you're going to write your answers, what your opinion is after reading the article. And you have to use the APA citation format, okay? And make sure your article is not something that was written back in 1954. Or it needs to be no more than 5 years old. So choose something 2019 or later. Okay. We talked a little bit about exams and quizzes. Your HESI is what we call a specialty exam, because OB is a specialty. Okay. Med-Surg is not really considered a specialty exam. It's a dosage calculation exam, okay? When you take the HESI in week 11, when we finished all course content, you will only have one opportunity. You won't be able to retake it, okay? It's really important that you prepare beginning now to take a HESI, okay? Don't wait until the last minute and think about what do I need to study? Every week, we need to bring forward the important concepts that we're learning about, review from before, and then continue on with new content. Okay. All right. Okay. So that's any questions. That's the end of the orientation. And I know a lot of that is going to make more sense once you get into Canvas and start.
I do have a question.
Yes.
Okay, for the quiz and exams, do you give key concepts or do you do like a review? I know some teachers do like the key concepts or they'll have like a review.
No, we don't give you any kind of key concept or anything to prepare for. Just knowing that it's the prior week. So for preparing for a quiz next week, you're going to look at the documents I sent you and the documents I'm giving you, and then go to your book and look those things up in your text. Okay.
Okay.
Hannah?
Hey, I was just gonna ask, I can't figure out how to change my cohort in the Evolve. It said to
Okay.
register for the HESI like prior to this, and I looked and I can't. I think it's because the cohort's wrong, but I don't know how to fix that.
Oh, okay. You might be in the December cohort.
Is that something we can fix? Like, can I fix it this week
Well,
and then just register sometime this week? When
you
I'm on
can't
campus?
register. You can't register for a HESI right now because you can register for the HESI Next Gen account. Is that what you're talking about?
Is that where it says like, I think mine says Nashville RN HESI something. It's what you click on to get to the exams, right?
Okay, okay. Well, there's no
That-
exams there's no exam ready for you until later.
Right. So
See,
it just
how
meant,
that work? Yeah, the HESIs have to be scheduled by the dean of the campus.
yeah, but it was just telling us to register for that umbrella thing that you click on to get to the HESIs, right?
Yeah, you have to register for a HESI Next Gen account.
Okay, I think I already have one of those. I think I'm good.
Okay, okay, yeah. It's in the Evolve. I think there's a link in Canvas as well to get to it. Cassandra, hi.
Hi, I have a question about the NCLEX questions. If I take the first attempt and I don't have a 78, do I have the opportunity to take it a second time?
Yeah, NCLEX questions, you can take it as many times as you want to.
Okay, thank you.
So if you submit NCLEX questions and they're 70%, I'm going to say to you, are you sure you want to do that? Okay.
Okay,
So, yeah,
and
you can do those more than one time.
okay, thank you. And what about the case studies as well?
No, your first attempt on the case study is your score.
Okay,
Now, if
Thank-
you don't do well on it, you can take it again, but I take your first score.
okay,
So
And-
as you're doing it, Cassandra, look it up. If you don't know what the answer is, if you're not sure, then go to your text and find the right answer.
okay.
Okay.
Thank you. And I got in late. I was wondering if I can stay after the class for a few minutes so you can go over the things that you went over at the beginning when I was not there, please.
I'll try to remember it, but I'm recording the class, Cassandra. So you could just watch the very first of it.
Okay, thank
But
you.
I'll still be glad to meet with you after class, okay?
Okay, thank you.
You're welcome. Any other questions? Those are all good. Okay, usually when we're in class, we're here until 5:30. So every hour or so, we take a break. Okay, so it is 3:54 my time, 2:54 Mountain Time, 2:54 Central Time, and 1:54 Mountain Time. So be back here at 10 after the hour, whatever that hour is, okay? And we will begin to talk about some content. Okay, JP, can I help you? Did I pronounce your name correctly?
Yes, you did. Thank you. I just have one question. It's about the unit exams and quizzes. Well, unit exams, because that's the one that has Exemplify, right? Or
Yes.
ExamSoft. Anyhow, you said our camera has to be turned on for that. But then when you go and access ExamSoft, I don't think it allows to have your.
No, it doesn't. So you have to use another device. So
Okay.
you can use your phone to get on Zoom.
All right.
So your phone will be there with you on the camera, and then you'll be on your computer to take the exam.
Okay. that
Or
makes a
you
lot-
can use an iPad or any other computer device that has a camera.
All right. Thank you.
You're welcome. You picked up on that early. All right, I'll see everybody back in 10 minutes. Yeah, you don't stay on Zoom, but just turn your camera off to take a break. Okay, very good. I do want to show something to you. I'm going to pull up the what you see when you look at your announcements. If in Canvas, you have on the left, you have home, announcements, the syllabus is here, modules, people, your grades, and then VitaSource bookshelf. You should be able to access your book there, but you have to register first. So all the announcements that you've already received, the one at the bottom, I posted it quite a while ago, just some information about technology, and just an introductory to OB. Here's your e-textbook information. If you want to click on that, you can check that out. And just the cover sheet that tells you what the course is. And then discussion helps. I talked to you in here about resources, how to do APA, what format, how to do that. and just some directions there. And then something about standards of integrity and standard as a nursing student. There's a message from Dean Brown for you, and then Dr. Brown's math video. Let's see. So every week on Friday, later than at the latest Saturday, I will be putting out a weekly Zoom, or I'm sorry, a weekly announcements. Okay. And within that announcement, it's going to tell you what we're doing for the class time, what to prepare for, the documents I send to you, any videos will be in here. So these are usually links. So like reading, there's some videos here, how to set up a calendar, how to read the book, how to take notes, what's a concept map, then documents for week 1, the pregnant woman I talked to you about, and we're going to do learning style today. And anything else that I want you to have, I'll put it in here. Okay. Any other information will be in here. So every week you'll get information to help you prepare for the following week. Okay. The online orientation that we went through today is right here, this link right here. And then we're going to do a class activity if we have time. And other things. Okay. So your assignments this week will be listed at the bottom. And then when the class is over, I'll post the recording right here at the bottom. So every week you'll have access to all this information. Any questions about announcements? You really do need to be looking through them because it gives you all the information that you need to know. Okay. All right. Any questions at all? Kind of went through a orientation. It's kind of dry, I know. And I know I'll have to repeat some of that stuff next week. That's okay. When we talk about evidence-based decisions, what do I mean by that? What do I mean by evidence-based decisions? Well, you don't have to think of nursing. What do we mean by evidence?
Something
the word?
something that has been researched on and have proof for it.
Okay, so some information, some understanding, or some facts that we have figured out based on research. Okay, so evidence. So evidence-based means that I make a decision as a registered nurse, as a provider, make a clinical decision to help my client, right? A decision to provide care. So let me give you an example. Let's see. What do you see in front of you?
PowerPoint.
Okay, good. So do you see evidence-based clinical decision? Is that what you see?
Yes, ma'am.
Okay, good. So when we talk about evidence-based, we are making decisions based on what the research has shown us. Okay, for an example, and it's still common thought, and you'll still hear the conversation that every woman needs a pap smear when she turns 18 or when she becomes sexually active. But research that has been done has shown us that we don't need to do pap smears before the age of 21. So the guidelines recommend Pap smears not to be done before the age of 21, no matter what. Okay? Because what happens, there's a virus, and you probably have heard about it. It's called the human papilloma virus. It will damage cervical cells, and that can lead to cancer. If you have an 18-year-old, even if she's sexually active and she contracts HPV through sexual activity, well, that virus could be destroyed by her immune system. And more than likely it will be, okay? Because she has a very strong immune system, okay? We don't notice any damage, or the research, the evidence is such that we have not seen damage to cervix from HPV before the age of 26. Okay, so it's really not even recommended to check for HPV at all until the age of 26. Okay, but we do a baseline pap smear at the age of 21 just to look at the cervical cells to make sure there's no abnormal cells growth. Okay, any abnormal cells that look suspicious for abnormality. Okay, so we only do pap smears after the age of 20, so beginning age 21. Okay, but you've probably heard other ages, haven't you? Yeah. Okay. So some other terms from that very first and second chapter in your text that you need to be familiar with are standards of care. A standard. For example, I'm going to say Taylor likes to shop at Macy's, and she doesn't like to shop any other place. She has to have clothes from Macy's. That's her standard of living. That's her standard, and she won't go anywhere else. Okay. As a nurse, standard of care is such that you practice in a way that is safe and that's expected of you based on what other prudent nurses would do in the same or similar circumstances. Like one thing would be you have a client that had a C-section and she has a Foley end, and the order is to remove the Foley when the patient is ambulatory. Okay. But you notice as a nurse that you think that there's blood in the urine because it's got an orange color to it, and you're concerned. Okay, you're suspecting blood in the urine. So a prudent nurse is going to contact the surgeon before she removes the Foley. Okay. If she doesn't and she removes the Foley, knowing full well that there might have been blood in that urine, then that you could have a client that's bleeding internally, and you would be at risk for negligence for not notifying the provider. Okay. In other words, you need to practice nursing as well as any other nurse. Okay. Negligent is stating that you have a relationship with a client. You either did something or you didn't do something, and harm came to your client. Okay. So all three things have to be present for it to be negligence. Okay. You have to have that client has been assigned to you. Okay. You didn't do something. Or you removed a central line dressing and you didn't do it using sterile technique. So you caused harm because your client developed an infection. Okay. So that's what negligence is. Performing only within your scope of practice as a registered nurse. So even though as a registered nurse, you can change central line dressings, if you've never been trained in sterile technique, then you shouldn't do it. Okay, you're going to have to ask for training or someone to teach you how to do it correctly before you do it. So make sure you're not doing something that you feel uncomfortable with. It's better to be embarrassed than to cause harm to a client. Okay. If you don't know something, ask for help. Make sure you know the protocols in the facility that you're working for. You know what the guidelines are. You know what the evidence is. You've got resources all around you, and pharmacists are great resources. A sentinel event is another concept, something that occurred that caused some kind of harm to a client, whether it's temporary or permanent. Okay, something that wasn't expected. Okay, maybe administering a medication that caused an anaphylactic reaction. We weren't expecting it. The client didn't know she was allergic. And another example is called retinopathy of prematurity. And that's something we talk about late in this class. Is it's damage to the blood vessels of the eye of a preterm baby because they were exposed to too much oxygen. That's considered a sentinel event, because it usually causes blindness. Somebody tell me, what is informed consent? What do you know about informed? I know you probably took this in Foundations of Nursing. What's an informed consent?
The client's giving you permission to do whatever test or surgery or procedure, and they know what it is, exactly what it is, and any risks, what it's going to be used for, what the expected outcome is, etc.
All right, very good. Yeah, they have to be informed. They have to know those risks associated with that procedure. Now, they might not understand it, but they understand it so that they recognize whether they want to make that decision. Okay, good. Can you give an example of something that we need a consent for?
Blood.
Blood
Technically everything?
transfusions, yeah. Blood transfusions. Anything else?
Don't we need consent for technically everything?
Well, we have consent to treat. So when a client is admitted to the hospital, they consent to treatment. So to start an IV, if a provider orders a particular IV of magnesium, you don't need consent for that.
So
But you need
invasive procedure.
invasive procedures, cesarean section, any surgery, okay, amniocentesis, thoracentesis, things like that. We need permission because they're invasive. We need to review what is risky about them. Human trafficking. For those of you in Orange Park and Pensacola, as a registered nurse, Florida requires that you take 2 hours of continuing education in human trafficking. So it is really important. They've got terrific continuing education documents out there to read about. This is a website, a government website, where you can read about human trafficking. If you don't know anything about it, I would recommend that you read it and become familiar with what it is. Okay, what it is. And then if you suspect a client is being trafficked, then there's a hotline here that you can provide them, but be careful. Sometimes we don't know the best thing to do, and that's why continuing education is really important for nurses. Okay, so I put that information in your text on page 47. There's some information. You might want to look at that. There's a box 3.9 that talks about it. So review that a little bit in your text. And then the National Domestic Violence Hotline. Sometimes we call this intimate partner violence. IPV. There's a hotline there, 800-799-SAFE. And then some other websites that you can look at. Your text does talk about intimate partner violence. What does it look like? What is it? Who is familiar with intimate partner violence? Can anybody describe it to me? Like, you know, a big picture of it, what it is? Anybody have any experience with that? I don't mean personally, but know much about it. You do hear about violence against women. There's a federal law about violence against women. So the nurse who witnesses a violence, it's in your book too, but you can read through that a little bit. It's uncomfortable for us because we want to help, and if you're not trained, believe it or not, if you're not trained, you're not going to be much help to your client. So the term intimate partner violence, it's a physical violence, usually. Domestic violence and abuse can also be emotional abuse, and described in all other kinds of ways. Stalking is considered abuse and violence. Psychological harm. I had a client, she was fairly young, and she and her husband moved to, I was living in Nashville at the time. She had moved to the area from, I don't remember where she moved from, Minnesota or somewhere. And because her husband's mother lived in Nashville. So they moved to be closer to his mother. He was very controlling. Okay. She didn't have a car to drive. He gave her an allowance. She wasn't working. She had a high school education, but she had no college or any secondary or advanced education. So she had trouble finding jobs, and he really didn't want her to. So she didn't have access to much of anything. And she wanted to go back to school. And so we talked about that. She was assertive enough. She was figuring things out. And she was assertive enough and was able, even remaining married, to get to school and to find a job. And she just put her foot down, and it worked out for her, but it doesn't always work that way. Doesn't always work that way. So there's also a link here that you can look at and read about that a little bit to learn about it. What are the signs? What are you seeing as a nurse that you suspect your client is being abused? Does anybody know? What
No,
might you
one of
see?
them is like bruising, like healing in different stages.
Okay, yeah, that's right, Hannah. If she
Failure
has
to
a
make eye
bruise,
contact.
they don't like to make eye contact.
They'll
The
look to the
guarding.
partner for answers.
Yeah, they're withdrawn.
Withdrawn, guarding, Thomas said. What else?
They'll look to the partner for answers because they're hesitant to answer.
Yep.
A lot of times the partner doesn't want to leave them alone, so you have to try to isolate it to get them to where they have a safe space. Safety is always the biggest concern with that.
Yeah, they're very dominating, and they usually don't let their partner out of their sight. Yeah, very dominating. And I've had that happen, and just very respectfully and with a very calm tone, just asking them to step out of the room while I do the physical exam. And usually I've not had anybody really resist that, but it gives an opportunity for me to ask a few questions like, do you feel safe at home? Or has anybody ever hurt you? And she might not answer those questions, or she might answer them and not tell you the truth. But if you open that conversation, and if she's pregnant, then that conversation can continue throughout the pregnancy. During pregnancy, unfortunately, if there is a past history of intimate partner violence, it tends to escalate in pregnancy because you have a relationship that's already tense. There's a lot of tension in the relationship. And now you have a huge thing that has occurred. She got pregnant. So now there's this baby. And if they weren't expecting this baby, it was unplanned, like half of pregnancies are, then it can cause that relationship to even go through worse violence. So it does increase up to 30% during pregnancy. Okay. So look at box 3.1 in your text on page 51 to look at some of the other signs that you might notice. Sometimes clients will call the office, the OB office. They'll make extra appointments for vague reasons. Female circumcision, we call it female circumcision and not mutilation. And it's an illegal practice in the States. It's a cultural practice in different parts of the world, and we need to respect it as such. So if you have a client that's from another culture that immigrates to our country, and we do have a lot of immigrants, especially in Nashville, I know there's huge numbers of immigrants. I don't know about Orange Park. Don't know about Orange Park or Pensacola, but in Nashville there are. So being aware of the practice, it's an acceptable practice, and women expect to be circumcised. They might not refer to it like that in that culture, but that's the way we have to refer to it, okay? So if I'm taking care of a client and she's pregnant, she comes in for her first prenatal visit, and when I do my exam, I notice that there's been some surgery, removing all the external female genitalia is one thing that's done. And the reason that's a concern to me is that what are we going to do now for labor? Because that develops scar tissue. And so that tissue doesn't want to stretch. Okay. And so it might be very difficult for her in labor. So making plans ahead of time. What can we do between now and then to help our client? Okay. So always refer to it as circumcision, female circumcision. And remember that it's illegal to perform that kind of surgery in this country. Another term is ethnocentricity. Ethnocentricity, I broke the word up for you to help you understand it. This is still difficult for students. Ethno means self, and centricity means central. And so if you look at this picture, it's you as the nurse. If you're an ecocentric nurse in the middle of this diagram, that means that your values and your beliefs are the right ones. And your client's values are not right. And they need to adopt your values. Or maybe your friends. You think your friends should be just like you. You're very self-centered. Or partner values. If to a man and a woman, if people get married, we compromise, we work together. But in a marriage or in a partnership where one expects the other one to do everything the other one does, that's not going to work. That person is being a narcissist or very ethnocentric. It usually has to do with values and cultural practices. Okay, co-workers. Okay. So as a nurse, don't be ethnocentric. It's a negative connotation. Okay. So be willing to work with your client according to what their values are. Who do you want to be in the labor room with you? Talk to them about this early on. So, because some cultures want mom to be in there, or some cultures want no one else in there. They want, I know I've taken care of women from Egypt, from the Middle Eastern countries. They don't want men involved at all. Okay. And they really request that a female deliver their baby. So if you have a client come to your office and you have a male practitioner or male physician that's going to be delivering the baby, they need to know that ahead of time so they can find somebody else if they don't want that. And so the last few slides, review your female anatomy. I'm going to assume that you know it. Okay, I'm not going to take time to go over the anatomy. That's something that you should have learned in A&P. The female breast, first signs of puberty is development of breast buds. During pregnancy, hormone levels rise, as we'll talk about next week. And those hormones have a profound effect on the whole body. And one thing that progesterone does is causes tenderness in the breast. So breast tenderness and the growth of the breast caused by estrogen. So we'll learn about these hormones and how they support a pregnancy. Okay, and then menarche is just the onset of a menstrual period. And this just lists of all the hormones that we talk about in this class, which we'll go over in more detail next week. But you can begin to read about them in this PowerPoint and go to your text and read about them as well. Don't try to understand or memorize all the different kinds of cycles that a woman can have: ovarian cycle, endometrial cycle, hormonal cycle. You don't need to know all those different cycles that are in your book. Okay. And then we talk about a little bit about the first couple weeks. What women are at risk for having a troubled pregnancy? In other words, what is it about their background or their health that puts them at risk to have a pregnancy? It can be it's so many things, so many things. So one thing is obesity. Okay, obesity. And we talk about that a lot during this class, because obese women have trouble during pregnancy. They might have trouble getting pregnant, keeping the pregnancy, or develop high blood pressure or develop gestational diabetes. They might deliver prematurely. It's a lot of risk in pregnancy. So you need to know the ideal BMI. Okay, I have it written up here. Underweight. Any BMI less than 18.5 is considered underweight. So if you have a client that's underweight and then they get pregnant, what would you want to know? Jen, you have a client that comes to the office and you're working in an OB clinic, and her BMI you calculated and you came up with 18. What would you want to know? What kinds of questions would you want to ask your client?
What type of diet they have daily, how many calories they're taking in, what type of foods they're eating.
Yeah, exactly. And you might even go into, if you suspect anorexia nervosa, maybe they have some kind of an eating disorder or something like that. So yeah, you want to know some more information. So if you have a low BMI, then you need to gather information from your client, and then you're going to educate. You're going to explain to them, what they need to eat, and you might want to get her to go to a dietitian as well. And I think mainly when you have a low BMI, I always think of adolescents. Okay, so adolescent group, any client under 19 years old, is high risk. I mean, it's automatic because she's young and she's not fully mature yet herself. So they're at risk for low birth weight babies. So an obese woman, what if you had an obese woman? Would it be any different?
No, you'd still want to know what their daily intake is and what type of
Mhm.
foods they're eating. Are they eating
Yeah.
too many high fat or complex carbs that are going to cause their weight to keep going up or
Okay.
to increase their metabolism of their sugar processing?
Okay, good. Yeah, we want to know what they're eating, what kinds of food they're eating. That's important. You'll learn next week that 40% of calories during pregnancy need to come from fat, 40% from carbohydrates, and the rest of it protein. Okay, so we don't push protein in pregnancy, believe it or not. We push carbs and quality carbs, like complex carbs, like Jen said, because they're going to have that more stabilizing glucose, okay, instead of simple sugars. So yeah, so we need to educate. We don't ever put a pregnant client on a diet, okay? We want to, like Jen said, tell me what you're eating. And we can discuss what she's eating. Maybe it's a volume issue. Or maybe we need to add in potatoes instead of something sugary, okay? So we need to see the quality of what they're eating. Good. So obesity in pregnancy or becoming obese in pregnancy can lead to a whole list of things. Gestational diabetes, like I said, preeclampsia, preterm, usually extreme prematurity, stillborn, labor dystocia or labor difficulty, newborn respiratory distress. Okay, stillborn, I said that. A lot of fluid, polyhydramnios, okay, infections. So it's not a good thing. Going back to just almost as a review then, health screening standards, women's health, the management of a woman's health when she reaches a reproductive years. First of all, Pap test at the age of 21. Okay. Pap tests, they need to be educated. We need to make sure that they refrain from sexual intercourse at least 24 hours before the procedure. During Pap smears, we might incidentally find sexually transmitted infections like chlamydia or gonorrhea. Okay. If you have a client that's 18 and she's pregnant, we're not going to do a Pap smear. Okay. We are going to do vaginal cultures, okay, to check for infections. Okay. So I want to talk a little bit about what your book talks about and the benefit of taking some time to talk about this. And then what we'll do is we'll do a learning activity. Your book talks about disparity in healthcare and barriers to healthcare. What does the word disparity mean? D-I-S-P-A-R-I-T-Y, disparity. What does that mean? And if you could give me an example. Disparities.
Is that like an obstacle of what keeps people from getting adequate health care? Like maybe like transportation and
Okay, yes.
cost and stuff like that?
Yes. So a disparity means that there's a gap. Okay. There's a gap. Some clients are lost in a hole somewhere. They're not getting the care they need, either because they don't have access, they live out in the middle of the country and there's no obstetrician out there. So they see a family practice, or low income. They don't have the resources. They don't have a car. Like Hannah says, no transportation. So there's a disparity. We know that some races, there's a disparity between races. And for example, African Americans have a high risk for premature babies. Okay, they have a high risk for high blood pressure. They're at risk for those things. And if they don't know and they don't have access to care, they don't know they're high risk. Okay, they don't have what they need. Okay, so health illiteracy means that people don't understand what they need. They don't understand how to navigate the healthcare system. And it's so common, so common. You know, I moved from Tennessee to Michigan. In Tennessee, I'd been there for so many years. I knew people. I knew the healthcare community. I knew who I could go see, and I had everything I needed. I moved up here. I don't know anybody in the healthcare community up here. It's been a challenge because calling the doctor and say, you need to do this for me because you haven't done it. It needs to be done. They don't take it so lightly. They ignore me like I don't know what I'm talking about, but I do know what I'm talking about. But the quality, it's not, I'm not saying the quality of care is poor. I'm saying the communication, navigating and trying to get things done is scary. And I think to myself, if I wasn't a provider, if I didn't know any better, I would really be in a bad way. So it's kind of scary. So preconceptual care, when we think about disparities, when we think about the lack of access to care, not knowing, not having what a client needs, and the high rate, the US has the highest infant morbidity and mortality in the world. Did you know that? Of all places, we thought we had the best of everything, but we don't. We really don't. We still have high levels of mortality in our babies. And a lot of it is because lack of prenatal care or inadequate prenatal care. A woman has had 3 children. She knows what to expect. She doesn't show up until she's 20 weeks pregnant for her first prenatal visit. No, she needs to go by the 12th week. And so some of the things that we see commonly are congenital malformations and prematurity. Okay, usually the number one reason that a newborn is admitted to NICU, neonatal intensive care units, is because of prematurity. But we also have rising rates of substance use in this country, and we're seeing it in our newborns. Okay, so what can we do as far as preconceptual care? Even though half of the women get pregnant and not know it, not plan it, I should say, we're kind of behind the ball. Okay, so next week when you do your first discussion, that's what it's going to be about, preconceptual care. What can we do? What are some strategies that we could do to help? And I sent you an article about this, written by the Academy of American Family Physicians. And it's an excellent article. And I'm going to have you use it for your assignment next week on the discussion post. We're all going to be reading the same article because it talks about all the possible problems without prenatal care. Women with chronic illness, women with substance use. How do we reach these people so they have the best pregnancy, that's the safest and the healthiest outcomes? So we're going to be doing that next week. So an example, I want to give you an example. So a diabetic client, whether type 1 or type 2, okay, she gets pregnant. Now, we don't see a lot of these clients because they usually cannot carry a baby through pregnancy. Although I've taken care of some type 1 diabetics that were very successful, okay? But she had good access to care. What if you have someone who lives out in the middle of the country, or someone that's immigrated and doesn't speak the language? they're going to have a myriad of poor outcomes. So some of the things that we see with diabetics is a spontaneous abortion or miscarriage. Okay. Congenital malformations. Baby doesn't form correctly because her sugar levels have been too high. Extreme prematurity, preeclampsia, hemorrhaging, infections, and then her newborn has all kinds of problems. Okay, so that's an example. All right. It's almost been another hour. So when you read your text, just kind of focus in on the PowerPoints so that you don't get caught up. You know, don't memorize the first pap smear when it was done. The historical aspects of nursing, although later in your career, when you're working on maybe you want to advance your education and you want to specialize, then you want to know that stuff a little bit more. Okay. But right now, you're not going to be tested on any dates. Okay. You're not going to be tested on anything like that. Okay. But look through your text at all the terms we talked about today and use what I've given you as a guide to reading those first 3 chapters. Okay. All right. So I've done a lot of talking, and this is kind of unusual in one way because we usually do activities and stuff like that. So now we're going to have some fun, okay, for a few minutes. Do you know how you learn? How do you learn? When you think about the class that you took, how many of you took fundamental? How many LPNs are here? LPNs? Okay. Did you take fundamentals or foundations? No. Okay. All right. So when you think about the classes that you've taken before, and maybe microbiology, for example, and maybe you didn't do as well as you wanted to do. Why do you think that was so? You think you just didn't know how to study, or you didn't know, you thought you learned it one way and you really learned a different way? And you think about that. Have you ever thought about that? Yes, no?
I can't speak for anyone else, but a lot of the theory stuff doesn't really apply to day-to-day working, and I generally ignore it because I don't use it.
Can you give us an example?
Like the ATP process for cellular energy conversion. I mean, yeah, it's important to know, but that doesn't help me change dressings or take care of a patient or keep them clean or whatever. So I
Okay,
I
okay,
need
gotcha.
training on
But
doing
you would
sterile.
need to know, yeah. So, but you need a foundational learning, because if you were going to go to become a dietitian or into nutrition, a specialist, you would need to know all that. Okay. So, anyway, so let's talk about maybe how you learn. Let's figure this out. We did this last quarter for the first time. So what is your learning style? So if you want to screenshot this, although I gave you this PowerPoint, but if you want to screenshot it and answer these questions, if you agree that, like, number 1, I like to look at pictures, graphs, and charts. It helps me learn. It makes sense to me when I look at these things. Put a check mark by it. I can picture information in my head. I like quiet in order to learn. I like to sit in front of the class. I find it hard to listen to others speaking. I record this class because you're not going to remember even half of what I've said today. Especially if you're this kind of a learner. I can tell you one thing I learned about myself when I was working on my bachelor's is that I had to read the text and write notes before I even went to class. Because I don't hear. I just don't hear. I mean, I'm hearing at the moment, but it doesn't stick. Okay. But if I read it and took notes before and then went to class and I would fix my notes, add to my notes what the professor was saying, and then I learned it. I did okay. If you purchase a piece of furniture that you have to put together, what do? First thing, what do? You look at the pictures first and then look at the printed instructions? Or do you automatically go to the printed instructions and then refer to the pictures? Do you like handouts? And in order to study, you read your notes instead of doing anything else. So that is a visual learner. That is a visual learner. Janae is going to fall asleep. This one is an auditory learner. I haven't seen, this is very rare, but if you like to talk to yourself as you're learning, you read out loud. You like to listen to other people, you learn by listening, and it's easier for you to remember. You prefer lectures over reading. You like to study with somebody else and test yourself. I enjoy listening to music. I learn from watching movies. You could also put videos there. I like to speak in front of people. I'm good at explaining things. These are auditory learners. The last one are called kinesthetic learners. Kinesia means muscle movement. Okay, kinesthetic learners. I like to work with my hands. I enjoy doing projects and working them out. I need a lot of breaks. I talk with my hands. Field trips. So very interactive, okay? I need to be able to move around. I like to play sports. Flashcards are good. And I like to act things out. Case studies are almost like kinesthetic, not quite, but case study, if I present a client to you and give you some information, you know, what do you see in this client? So it's like an investigative thing. So those are the three kinds of learners. So if you think that you're a visual learner, put your hand up. If you think you're visual, in other words, you like to look at pictures and graphs, you want to read the text, highlight, it has to be quiet, you like to take notes. Tracy's definitely shaking her head. Organized, you have to be organized. You spend a lot of time trying to organize yourself. Auditory, you like to hear stuff. You like somebody explain it to you. And then kinesthetic, you like to just do hands-on. Just show me, don't tell me how to take the blood pressure. Just show me how to take that blood pressure. Let me do it. Okay, yeah, okay. Kinesthetic, okay. So you might overlap a little bit. You might do a little bit of both, auditory and kinesthetic. It's not a perfect way of explaining it. And the reason we do this is because if you are depending on learning from Zoom class and not preparing at all, and just relying on this time, you have to be an auditory learner. If you're not an auditory learner, then you better be doing other things. Okay, you better be thinking about how you learn. Everybody needs to read. Okay, what you do, how you read. Okay, you might come up with your own little jingles to remember something by. So are you surprised? Have you ever heard of anything like this before? Yes. So now, how many of you think they're visual learners again? I can tell you most people are visual. Okay. How about auditory? Just want to hear it. And then kinesthetic. Yeah, so you might be visual with a little kinesthetic. That's me. I don't remember anything auditory. Okay, so if you are dominantly a visual learner, what should you be doing? You look at things. Okay, you should be looking at things. You'd rather take detailed notes during lecture. If I'm saying something, ask me to repeat it so you can write it down. You know, sometimes I realize that I take a lot of notes and then I never go back to those notes because when I write it down, I'm learning it. It's a different process of learning. You actually make to put it very plainly, you actually make a new nerve or a new nerve pathway process when you write things down. Okay, your brain thinks differently. And that's writing. That's not typing on an iPad or a computer. That's writing. Okay. Pictures, charts, videos. So most of my PowerPoints I give you have pictures, charts, and videos, because I have one that we'll be talking about a pregnant adolescent next week, and we're going to talk about the antepartum, what we do for her. And there's pictures in there, and you might remember, if you're taking an exam, you might remember a picture from that PowerPoint and an explanation of something. That's why I think they're good, because they work for me. And I do like a quiet place, a dedicated place. So one thing I recommend to those of you who are visual, always study in the same place. Okay. If it's in your kitchen or in the dining area where you have a table or something, or you prefer the bedroom, make sure you always go to the bedroom to study. Q word, we are doomed. What does that mean? Quiet? What do you mean by that? Is it Rayford? He's not answering me. Okay. Highlighters and text. All right. What do you think you should be doing if you're an auditory learner? What would you do to support your learning if you're an auditory learner? What do you think?
You can listen to podcasts in your car.
And I would recommend the stuff that we give you, not podcast, because they might be teaching you something different.
No, I'm just saying far as medical vocabulary.
Yeah. Okay. Medical vocabulary. Yes. Very loud. Okay. Okay. So yeah, listening to the recordings of lectures on your way to school, when you're driving, when you're doing laundry or something, have it recording, have it listening that way. Good. talking through a problem. Okay, so kinesthetic, how are you going to learn? Take frequent breaks. Stand when you're studying instead of sit. I thought that was interesting. Chew gum. Eat while you study. Okay. And these are other things that you can do the way you learn. So you can look at this. All right. Let's take another break. I'll be here if you want to talk to me, but I am going to pause a recording. OB, it's almost, I considered almost a hodgepodge of stuff. And it's kind of hard to organize. So that's why I go through it the way I go through it. I really wish I could just jump into week 2. But really, when we talk about disparities in access to care and important things about preconceptual care, you will see how that will affect the rest of the classes. Because if you have a high risk patient, why are they high risk? They should have had preconceptual care, you know? So it does make a difference. And you also need to be knowledgeable about the state of affairs of our health in this country. Our health care is very expensive in this country. We spend a lot of money on health care, and we don't have super outcomes to substantiate why we spend so much money in health care. So it is important to know those things. So let's take a few minutes. I'm trying to get my screen to work. Let's talk about discipline. Okay. So what do you think are some of the important things that you would do for your client? Let's say you are working in an OB clinic, okay? And you're the registered nurse there. If you have a client that comes in and she thinks she's pregnant, what information do you think you want from her? What would you do?
The date of her last menstrual cycle.
Okay, so you want to determine about how far along she is. Okay, what else would you want to know about your client?
Is she pretty regular with her cycle?
Okay, and what if she isn't?
Probably go about getting a pregnancy test.
Okay, good answer. Okay, what else? What else do you want to know?
Medications.
Okay, you want to know some history, right? You want to know, is she on any medications? Does she have any chronic illnesses? Okay, so we need to get a thorough history, a very thorough history. So we want to know about past medical history. Has she ever been pregnant again? Any major traumas? All of those things, okay?
Is this something where a family history of easy or difficult births would play a role in her being pregnant?
Yes. Can you think of an example?
No, that's why I'm asking. I don't know.
Okay. If we have a client that has a family history of diabetes and she is obese,
I was asking more like, if her mom had 5 kids and no issues, and her grandma had 3 kids and no issues, and her aunts have all had multiple children, no issues, is she more likely to have an easy, normal quote unquote pregnancy and delivery?
if she had similar lifestyles, yeah,
Okay.
I would guess. Yep. Yeah, because some women have a family history of preeclampsia, and they're at risk for the same thing. Just like if you have diabetes, you have a higher risk. If your parents have diabetes, you have a higher risk of diabetes. Okay. So we want to know about any stressors in her life, right? We want to know what's going on in her life. What is her lifestyle? Any cultural issues? We want to know about language, immigration status, make sure that's all updated. We want to know socially what's going on with our client. Are they married? Do they have a partner? That sort of thing. What was the pregnancy planned? Okay. Are they on any regular medications? Okay. What about illicit drug use? Any alcohol? So we have to screen for substance abuse. We have to screen for, and that includes alcohol, that includes nicotine or cigarette smoking, and we want to ask about caffeine. And then we have to also consider what age is she. The younger she is, if she's below 18, she's considered 18 and below, she's high risk. If she's, at what age do we consider high risk? Older women. Anybody know?
Isn't it like 35 years old?
35, very good, 35, exactly. Age 35 and on, increased risk for trisomies, like Down syndrome, okay? So we have to consider her age. Nutrition, we've kind of touched on this a little bit, okay? Any problems, obesity, eating disorders. What's her exercise? Does she exercise? Stress. Mental health conditions, any signs, any history, any family history of depression. Okay. And we're talking about, like immediate family, mother, aunt, uncle, cousin, sister, brother, that sort of thing, father. So taking that into account. So it may be a history of depression or anxiety. Sleep disorders. Any problems sleeping? Environmental and work hazards. What does she work and where does she work? Is she exposed? High risk sexual behavior. If she has more than one partner, or she's had more than one partner in a short amount of time before the pregnancy. So those are all concerns. And then of course, female circumcision. We've talked about intimate partner violence, understanding that it's something that we need to screen for if we see signs of intimate partner violence. We've talked about that a little bit, but to go into it a little more detail, IPV is a cycle, and it begins with tension in a relationship that continues to build. And the only outlet, if someone who feels so much tension that their coping abilities is not adequate, then they might actually abuse somebody else physically. So and occurs an abusive incident. And then they go through like a honeymoon phase. where the abuser is very apologetic and promises to change. He won't do it again. Okay. But if someone doesn't intervene from the outside, it's hard to fix. Okay. Because then that pressure will build, the tension will build again, and an abusive incident will occur again. It's a cycle. Okay. So as nurses, we know it's a cycle. Okay. So we have to educate our clients and let them know, what the research has shown us. It is a cycle. And even though the abuser has every intention of trying, if we don't do something about the tension and the stress in the relationship, then it's going to continue. So your text has a what's called an instrument or a tool to assess for signs of abuse. Asking your client directly. As a nurse, you are a patient advocate, right? You're the advocate for their health and well-being. You are in a respected role. So being very direct with your clients is important. Are you living? Do you live in a home where somebody is abusing you, whether it's a spouse or somebody else who threatens you physically, verbally? You feel threatened. You don't feel safe. Has anybody ever kicked you or hurt you physically? How many times? Has anybody forced you to have sexual activity when you didn't want to? Are you afraid of your partner? So these are very direct questions, but it's a screening tool. And it's a way of breaking the ice in the relationship that you will have with her over the next 40 weeks. So documenting those things is very important. And then there's a question here. I want you to read this question, and then I want you to tell me which is the best answer. So when you're thinking about your answer, think about your role as a nurse. If you work in OB, whether it's in a clinic or in the hospital, your role as educator and advocator. Which do you think would be the best answer here? Taylor, what do you think?
I said A.
A?
Yeah.
What do others think? Anybody else have anything other than A? Why do you say A?
Because it's always our responsibility to try and protect the client at all times.
Okay. Okay, you're protecting your client.
Yeah.
What's the difference between A and B?
I mean, with A, you're kind of just going over the basics, but with B, you're going more in depth, I guess, if you're assuming that they've been abused or something.
Tracy, what do you think?
I agreed that the choice was A, but I think B is just kind of explaining how the cycle of violence works, which really doesn't answer the question on the rationale for it, because it's more about you having to educate and teach her, because she was hesitant to answer in the beginning anyway. So you don't know exactly what's going on yet. So you don't want to jump to it's automatically violence, domestic or intimate partner, until you know more information.
Crystal, what do you think?
I agree with Taylor. I feel like that it is our ethical responsibility to protect our clients. And I also agree with the other lady as far as, I mean, we don't know exactly, is she being physically, emotionally, who knows? It doesn't state it.
I say it's B.
Yeah, I agree with him. I think it's B.
Okay, B. The cycle of violence which continues and escalates over time once it begins. So you are suspecting that she's being abused because of behaviors, okay? You want her to know. You're going to teach her anyway. Because you know during her pregnancy, it's going to continue and worsen. Okay. So the best answer is B. The best answer is B. Okay. Yes, it's your ethical responsibility to tell her, but it's also your responsibility to inform her about the evidence that shows that it gets worse during pregnancy. It's more important that she understands that it's a cycle and that it escalates. Okay. That's not an easy question. That is a question you really had to think about. And that's why I started it out by saying, remember your role as a nurse, advocator, and educator. Okay. You're advocating for your, it's not only your ethical responsibility, you want her to know. Okay. You want her to know as much as she can. So when you're talking to a client that uses drugs, who comes in for a prenatal visit and denies using drugs, and when she comes back and her urine drug screen shows that she's been smoking or using cannabis because she's got THC in her urine, then you need to break the ice and open the conversation, such as cannabis is showing by evidence that mothers who use it during pregnancy, what we're seeing in our newborns, possible heart defects, but more importantly, long-term effects such as what's it called? Attention deficit disorders and spectrum disorders, things like that, autism. That's what we're seeing, behavior problems. So it's like you don't want to just say you need to stop the drug, and you do, but you want to inform her further. You're educating her. We don't condone the use of cannabis during pregnancy because of this and this, just like alcohol. We don't know how much alcohol it takes to cause problems with the fetus. So we just recommend abstinence, abstaining from drinking any alcohol during pregnancy, and make sure they understand that beer is alcohol. Okay. So beer, wine, anything like that. during pregnancy. Okay, so it's your responsibility as a nurse to educate. Okay. I can't believe, oh, we went over time. Okay, so for next week, then remember that you have some work to do. You have to read, for next week, you have to read chapters 6 through 10. In chapter 6, is that right? Yeah. Chapter 6 is all about genetics. Don't get hung up about that. Okay, don't get hung up. I will give you some PowerPoints about genetics, the important thing about genetics. So don't read word for word in that chapter. Just highlight certain things. Okay. And then make sure you understand the anatomy and the physiology of pregnancy. What are the changes that you expect in a woman during pregnancy? So I'll give you all that information later this week. Okay. You'll have a quiz. 2 of the questions will be on anatomy and physiology. Okay. Or next week's content. The rest of the questions are going to be from this week. So you want to think about what we've talked about today. And then you've got your homework for this week, your calculations. Okay, reach out to me if you need help with that. And then just your introductory. Okay. Any questions? I know it's kind of a hodgepodge today. There wasn't really no real good flow. There never is on this first day. So everybody, no conflicts with schedules, right? Everything is good with your schedule? Yes? You know what you're doing when you're doing what?
Excuse me.
Yes.
I have to go pick my son up from daycare.
Okay, yes, go ahead. You're all free to leave. I'll continue recording until everybody's gone. So at least if you have something to say and somebody else wants to hear it, yeah, you're free to go.
Okay.
Yeah, you're always free to sign off at 5:30. Okay, I'm not going to keep you. Okay. So you're free to sign off.
I got a question.
Yes.
On our quizzes, are those going to be on our Canvas, or will that be?
Yes.
Okay.
Yes. Yeah, absolutely. So yeah, I want you to get on Canvas and I want you to play around with it. Go to the modules, okay, and play around with it. If you need help with that, I guess we didn't do that, did we? If you need help with that, I'd be glad to help you. Let me pull it up.
Hey, Dr. Zeller, can I ask you a question while you're pulling that up right quick?
Yes, please do.
I was in Dr. Roberts' class last term. It didn't go
Okay.
well. I was just wondering if we would be given, like, after exams, the opportunity to see, like, what we got wrong on our exams and stuff.
We can't share the questions with you. We share concepts.
Yeah, that didn't really help me because my issue was not the concepts like that y'all taught us. Like, I understand all of it. It's just the way that the exam questions were worded. So like whenever I asked her if I could go back and look at them to see like why I missed what I missed, she was like, "Oh, I can't pull them up." And then she decided she would read them to me, but that didn't work because I wanted to see it. You know what I'm saying? And it was kind of a mess. But I
Well,
was just
sometimes, sometimes it might not be that you don't understand the concepts. What I find that students don't read the question well enough. They go too fast, or they misread a
it,
word.
but it's like the way they, when there's like 2 right answers and you have to pick the better one. Like last time, I just wasn't really. I couldn't pick the better one because they both made sense. You know what I'm saying?
Yeah.
So
yeah.
Okay, I'll just try to read it.
Well, Hannah, we'll work on that this quarter. What I can do is when I see what you're missing, I can make up an alternate question that's going to show you why you chose what you chose and maybe figure out what's going on.
I mean, yeah, that would help because I
Yeah.
can't listen to it and be like, okay, that's why I missed it. It didn't make sense.
Yeah, I gotcha. Yeah, yeah.
Thank you. Nice to meet you.
Nice to meet you too, Hannah. Okay, anybody else have any comments or concerns?
Can I just clarify one thing?
Sure, please do.
So with a quiz coming up for next week, that's going to be over for what we talked about for today, right?
Today, there are going to be 7 questions from today, 2 questions from next week's content, 1 math question.
Okay, thank you.
So that's 10, yeah. And I was going to show you on your, let's see, let me get rid of this. Go away. So let me pull up your module here. So go into modules and you can see you've got your technology, your syllabus. You have to do all these things before you can come down to week 1. Okay, so you've got your OB calcs, and you can do that, your OB calculations. If you do them on a separate piece of paper, that is absolutely fine for this. Okay, and then if you want to just take a picture of it and upload it, okay, you have to submit it, but make sure on that picture you put your name. Okay, you can do it that way, or you can put it on another form, scan it, and upload it as a PDF. Okay. And then week 2, discussion 1, you should have access to this stuff. Let's see, April 23rd is due. You should have access to this stuff on this next Monday. Okay. So every week there's a module. So for the quiz, what you'll do is you'll click that right there. It says quiz 1, April update, and it takes you to the quiz. Discussion 1, it takes you to the discussion. And then the case study. So all Canvas are links to your assignments. Okay. And seriously, if you still have trouble and don't understand, please just contact me and we'll do it one-on-one together. Okay. We'll get on Zoom together and I'll say, click this, click that, and you'll learn it quickly. You'll figure it out then. Okay. But that's where you get all your information. Now the syllabus is your guide. Okay. The syllabus and Canvas should be aligned. Okay. If it says on the syllabus that week 2, you have a case study due, it should be on Canvas. Okay. When you get onto your Canvas, you should see the case study link. So just click on it and it takes you to the case study. Okay. Is that clarified a little bit, JP?
Yes, thank you.
You're welcome. You're welcome. All right. Thank you so much, everybody.